Our digestive system is impacting our brain health. When there's imbalances in our gut flora or all of those bugs in our digestive system, that really impacts our mood. My undergraduate and graduate degree was in nutrition and exercise physiology, and I loved nutrition. I loved working with people on changing their diet and realizing how powerful food is. So I wanted to learn more about how the body worked, and so I decided to go back to medical school, which was really a wonderful experience. But it took me a little bit away from prevention. So when I got out of medical school, I learned a lot about functional medicine at Canyon Ranch when I met Dr. Hyman and Kathy Swift. It was wonderful. It was this amazing experience for me because I realized that I could incorporate my nutrition background with my medical school training and really learn how to have this map to use nutrition as medical therapy. Functional medicine really gives me that map to incorporate my nutrition education and use nutrition as medicine. There was a lot of time in medical school and right after medical school where I was really questioning my decision. I was doing a lot of acute care medicine and we weren't really focusing on nutrition and prevention. And I was frustrated. I was absolutely frustrated with medicine and questioning significantly what I got myself into. And when I found functional medicine, it was great because I could say, okay, I can do this type of medicine. I really appreciate this type of medicine. I see how this type of medicine works. And it was that great map so I could continue to practice medicine in a way that I felt fulfilled. When I was 30, I was diagnosed with an aggressive type of breast cancer, and that came as a real shock to me because I was really interested in nutrition and prevention and had no family history of cancer. So when at the age of 30 I was diagnosed with breast cancer, I was completely shocked, as many people could understand. And it was a time where I had to step back and say, why did this happen to me? You know, what was going on in my body that allowed this to occur? That's when I'd started to learn more about functional medicine, and that really helped me answer that question of why, and to step back and say, what sort of shifts had occurred in my body that maybe had an impact on how well my immune system was working or my digestive system, and therefore the ability for my body to detoxify from toxins that I was exposed to, and how that influenced my risk of getting cancer. So it really helped me figure out what sort of things led to that cancer developing in me and how I could prevent it from maybe happening again. Patients always come to me and say, oh, you know, my doctor said it doesn't really matter what I eat, whether it's because they're having problems with their memory or their mood or their digestive system. And it's really because physicians have not been trained in the importance of nutrition. So they just don't realize, they don't know that there's such a connection with nutrition and our health. And we know that food is really powerful medicine. So there is a tremendous impact, of course there is, in terms of what we eat and the health of our body. And we're really working hard with the Institute for Functional Medicine to get that message out there and to train physicians so that they can recognize that there is this important connection and they can start to use food as medicine. There's absolutely an increase in brain disorders that we're seeing. And we know that, for example, with autism. Now 1 in every 68 children are on the autistic spectrum. And that's a huge increase. And it's a big concern. You know, there's multiple reasons for this increase probably, you know, from the toxins in our environment. There's an explosion of toxins in our environment to excessive use of antibiotics, to our really processed food supply. So there's a whole range of reasons why they were seeing this explosion in brain disorders. It's important that we look at all these different aspects so we can really decrease the explosion of brain disorders that we're seeing and have a good impact on people's brain health. The gut-brain connection really shows us that there's an absolute connection between all the different systems in our body, so that our digestive system is impacting our brain health and our brain is impacting our digestive system. And we know that, right? When we get anxious, we have digestive symptoms, like maybe some people get more constipated or other people may have more, you know, rushing to the bathroom. We also know that our digestive system is impacting our brain health. When there's imbalances in our gut flora or all of those bugs in our digestive system, that really impacts our mood and our brain health. So when there are imbalances in this gut flora, people can have more anxiety. We see that often, and that when we treat those imbalances with changes in diet, with good bacteria like probiotics, with fiber, sometimes even with medications to lower those imbalances. We see improvements in brain health, like we see improvements in anxiety. It's pretty exciting. Nutrients have a huge impact on our brain health. Some of the most important nutrients for our brain health are omega-3 fats. Omega-3 fats are those essential fatty acids that make up a good portion of our brain and are critical for adequate brain health. Unfortunately, we are seeing a decrease in our omega-3 fats in our diet. That's happening naturally because our food supply is becoming more and more deficient in omega-3 fats. Another really important nutrient for brain health is vitamin B12. Vitamin B12 comes from our animal protein and has a huge impact on our brain health. When there's deficiencies in B12, we see many disorders like depression, numbness and tingling, difficulty with walking, dementia, changes in memory. So B12 is critical for brain health. It's really important that we check B12 levels. We can do a serum B12, but that's not that great of a test. So we'll often look for other markers of B12 deficiency, such as the methylmalonic acid or homocysteine. And B12 deficiency occurs as people get older. We need to have enough acid in our stomach to digest our protein and pull our B12 from our food. So as we get older, our stomach acid often decreases, and that results in B12 deficiency. In addition, many people are on acid blockers. Acid blockers decrease the acid in our stomach. People take them for heartburn, for example. But what ends up happening is that we don't then digest our protein as well, and we don't pull our B12 from our food as easily. So many times when people are on acid blockers, over time they'll develop things like B12 deficiency. And B12, as we talked about, is critical for our brain health. Healthy fats are critical for our brain. Our brain is made up mostly of fat, and so it's really important that we get enough fat in our diet. Some fats, though, you want to avoid. Those are the trans fats or hydrogenated fats. And they've been largely pulled out of our food supply, but they're still there. So when you want to look at a label, you want to look for two things. One, you want to make sure there's no trans fats in that food. It'll say 0% trans fats, but sometimes foods can say 0% trans fat and still have some trans fat in it. So you want to look at the ingredients and make sure there's no partially hydrogenated oil in there. So if you see the words partially hydrogenated oil, you want to stay away from that food. There are some fats that, if they're not stored properly, can be unhealthy for us. So for example, some fats are very delicate. So fish oil or ground flaxseed, those are high in omega-3 fats, but it's really important that we store them properly. You don't want to keep your ground flaxseed on the shelf. It will get rancid or get oxidized, and that's really not good for us. So keep your flaxseed in the freezer, take some out every week or two, grind it in a coffee grinder, and then use that up within a week or two, and then you can replenish your stores from your freezer. Coconut oil has a lot of wonderful properties in it. It's a wonderful fat full of medium chain triglycerides, which is easily digested and absorbed into the body. There's been many studies showing that those medium chain triglycerides are good for our digestive system health, our brain health, and can be incorporated into a healthy diet. So, I feel coconut oil is a wonderful food to incorporate into your diet. There's a lot of new therapies out there that it can be really helpful for some people with brain disorders. In autism, we've been using, for some children, helminth therapy. Helminths are a worm that are parasites, but that are non-parasitic to humans. So that people will consume these helminths, and they impact their brain health. So for some children, the helminths will decrease the immune response in their body, will lower inflammation in their body, and they can have improvements in their symptoms. So that's kind of an interesting treatment that some people will benefit from, and really causes no harm to try. There's a lot of reasons why conventional medicine isn't always open to some of these alternative therapies. Some is just where the money is, and unfortunately that impacts how we're trained in medical school and what therapies we are taught to use. Sometimes it just takes time for us to realize how helpful these other therapies can be. And how much they can help people. And I think over time, more and more people will incorporate them into their practice. Well, another area we've been really excited about are looking for and detecting are these folate receptor antibodies. multiple children, a very high percentage of kids on the autistic spectrum have antibodies against these folate receptors. Folate receptors are in your brain, and you need folate, which comes from your foliage, all your green leafy vegetables. You need folate to bind to these receptors for proper brain development to occur. And unfortunately, a lot of children with these folate receptor antibodies are having changes or decrease in brain development. When we check for folate receptor antibodies, we see a high percentage of children on the autistic spectrum with these antibodies. There are ways that we can treat that. We can treat that by giving higher doses of folate and also by removing dairy from their diet, because dairy often will cause these folate receptor antibodies to occur. Oh, sleep is absolutely underrated, especially in our current culture. Sleep is critical for brain health. Sleep deficiency has been seen time and time again within multiple studies to be linked with decreased cognition, lower mood disorders, having a harder time with memory and focus and attention. Sleep is really critical for our brain, and we need to focus on it all the time. As our children, as all of us are using more and more technology, unfortunately, that often leads to less and less sleep and a lot of issues in terms of attention and focus and ADHD and memory problems. It's critical. Many times people feel that, okay, I can get by with 4 to 5 hours of sleep a night, or over time they just shorten their sleep cycle, a little less, and a little less, and they think they're getting away with it because they're not realizing how much it's impacting how they feel. So it's critical. I work with sleep with all of my patients. That's one of the first things I ask them. How many hours are they getting? How restorative is their sleep? Are they waking up in the middle of the night? Are they feeling rested when they wake up? When I was 30, I was diagnosed with an aggressive type of breast cancer. It was triple negative, and so I needed to go through chemotherapy and radiation treatment. Like many people who are dealing with a life-threatening illness, I went through those 5 stages of grief. First, it was denial, and then it was anger, and then bargaining, and then depression. Prior to the 5th stage, the acceptance, depression definitely set in, and it did for me as well. And there was many things that helped me through that process. One was just a gratitude journal. My gratitude journal was critical for me and helped me change my thought process and how I dealt with having this illness, and changed just how I thought about things, and really helped with my mood and realizing the good things that came from having gone through this process, this unfortunate diagnosis. I really paid attention to exercise. I really focused on exercising every day. Even on days where I really didn't feel up to it, I did something. I remember with my radiation treatments, I would walk every day to the hospital to get them done. And the exercise really was helpful. We know that when people exercise through their treatment, they often will do better. And if you're not feeling up to going for a run, at least go for a walk or do some yoga. So exercise really is helpful for our mood. We know that, and it helps when going through a difficult diagnosis. When I went through chemotherapy, I definitely got chemo brain. That is a hard thing to deal with. I had to learn how to be gentle with myself and to recognize that my memory changed for that period of time. And there were some things that really were helpful. Glutathione is a wonderful antioxidant and detoxifier. I use it all the time in my practice. It helped me, and it helps many of my patients. We can give glutathione as a liquid that gets absorbed through the cheek in your mouth. There's other ways you can give glutathione as well, IV and in creams. It's a really great antioxidant detoxifier that works well after you've gone through chemotherapy. NAC is also something I recommend all the time with my patients, about 600 milligrams twice a day. It helps the body with production of glutathione, as does all of your cruciferous vegetables, your broccoli, cauliflower, cabbage, kale. They help with glutathione production as well. So, we call junk food because it's really devoid of all of the nutrients that are necessary for our bodies to work well and our brain to work well. So it's got the calories, but it doesn't have really much nutritional value. And so it's important for all of us, and especially for our children, to really be watching, keeping the junk food away. Junk food's also high in additives and food coloring. And there's been multiple studies to show that these food colorings and additives can have an impact on our children's attention and focus. And we can see good improvements in kids attention and focus when we take them off of these processed foods and foods that have food coloring adding to them. Some of the most important things for improving your children's diet is first of all, just having good healthy food available. We know that when there's good healthy food around, kids will choose healthy food. So you want to get the junk food, get the processed food out of the house, and have healthy food around. Have vegetables cut up so kids can snack on them. Have fruit available. In addition, get your children involved in cooking, and get your children involved in the food that you provide for the family. When children are involved in cooking and food preparation, they're much more excited to try new and different foods. And so it's really a great thing that you can do for your kids, is get them involved in the kitchen, get them cutting up the vegetables, get them preparing the foods, because they're more likely to choose and eat them. We all recognize when our blood sugar gets out of balance that we don't feel good. So when our blood sugar drops, we all notice that we feel more tired, or have a harder time focusing or concentrating. So that's critical for all of my patients and for our children. It's really important that we work to balance our blood sugar. So what that means is that at every meal, you want to have some fat, some good healthy fat, some good fiber, and some protein. And those three things together will help keep your blood sugar balanced and help you feel better, have more energy, and have an easier time with focus. So often we're eating foods that don't help our body balance their blood sugar. So if we're feeling tired, we might reach for a piece of candy or a piece of fruit, and that might help bring our blood sugar up for a short period of time, but then it may crash again afterwards. So it's really important that you combine, and maybe for a snack, if you are going to have an apple, have some almonds with it or some nut butter with it. That the fiber and the fat in the almonds will help balance your blood sugar and help you feel better for a longer period of time. In addition, for breakfast, so often we're giving our kids cereal. There's really not a lot of good healthy fats in that. There's not a lot of protein, and sometimes there's not even a lot of fiber if it's like a sugar-filled cereal. So kids will then have, their blood sugar may go up quickly afterwards, and then an hour or two later, they're going to be feeling tired and having a harder time focusing in school. So it's critical at breakfast time that you have some, good protein, good healthy fats, and again, that fiber that can come from your vegetables and fruit to help keep your blood sugar balanced for a longer period of time. We can react to gluten and dairy in many different ways, but one way that many people react to gluten and dairy is because of these gluteomorphins and caseomorphins found in gluten and dairy. Gluteomorphins and caseomorphins are these peptides that can cross the blood-brain barrier and impact our mood and our concentration and our focus and our energy. And so many times when people come in with fatigue and or problems with focus or concentration, or with problems with their mood, depression, we can check for these gluteomorphins and caseomorphins. We can do a test to look for them, but often we'll just remove gluten and dairy and see if that helps with their energy and their focus and their mood, and it often can. We see the power of food as medicine in this practice all of the time. So I had a patient the other day. She was about 50 years old, and she came in with symptoms that we see all the time. I feel tired. I'm just having a hard time with getting up in the morning. I want to take a nap in the afternoon. I've put on about 20 pounds over the last couple years or so, and I just don't feel good anymore. And we always start with diet. And it's amazing to see how much people can improve just with dietary shifts. And for this woman, it was amazing. We took away the junk. We took away the processed food that she was eating and helped her with balancing her blood sugar. And we took away gluten and dairy. And for her, it made a tremendous impact on her brain health. She started to feel better. She had better energy. Her mood improved, and she lost that excess weight that she was struggling to lose. I had a boy who was 4 years old when he came to see me, and he was diagnosed on the autistic spectrum. And we did some simple blood tests. We found that he was really deficient in B12. And B12 we know is critical for brain health. We also found that he was low in vitamin D, and that he had a reaction to gluten. He had these gluteomorphins that were having an impact on how well he could interact with people and he could focus. So we did with this child, there was just 3 things that we did. We replaced his vitamin D, we replaced his B12, and we took gluten out of his diet. And it was amazing. He started interacting more. His communication came. He had better behavior. And he actually is not considered autistic anymore. Sometimes it's amazing to see how simple changes can have a huge impact on a kid's health. The most important things to do to improve your brain function is first and foremost exercise. Exercise is critical for brain health, and you want to get some exercise every day. Really important for prevention of dementia, but also for just improving brain health today. The second thing you want to do is really eat from the rainbow of colorful plant foods. You want to choose foods from every color of the rainbow every day. These phytonutrients that create the color in our plant foods have a tremendous impact on our health. So they have anti-inflammatory properties, they can prevent dementia, they can decrease risk of cancer. So you want to reach for a plant food from every color of the rainbow every day. And then the third, and probably one of the most important things we can do, is to get adequate sleep every night. You really want to reach for those 7 to 9 hours of sleep every night and really give your body time to rest.
Cancer is a very big topic, and we can't cover it all in 30 minutes, but you have a unique experience that has informed your way of thinking about cancer. Yeah. Because when you're 30 and you're now, can I say 50?
51, yeah. You can say it.
You had cancer. And when I first met you, you had really short hair because you just had chemo and all the treatments that cause you to lose your hair. And you actually figured out how to make sure that you weren't going to get cancer again. And a lot of people, knock, knock. Well, it's been 21 years. I think you're good. But it's interesting. I remember these patients coming to the practice, and one of them had like breast cancer, and she had colon cancer, and she had 3 cancers. And the doctor's like, well, we're just going to do screening. We're just going to see what happens. Good luck. You had your chemo radiation surgery, and now there's nothing you can do except wait, and we'll, do a active surveillance.
Right.
It's not active nothing. It's active nothing. You do nothing, and there's no plan of what to eat or how to figure out why you got the cancer or what to do about it. So whether you're wanting to prevent it or you've had it and you want to prevent and get it again, it's important to do a holistic look at your biology.
It really is, because, all of us are individuals, and for me, my undergraduate and graduate degree was in nutrition, and I was an exercise physiologist, and I love to eat right and exercise, right? So I was doing those things, but there were aspects that I needed to really focus on in terms of me being able to prevent a recurrence of cancer or another type of cancer. So yeah, I was 30. I had a triple negative breast cancer. I don't have any family history of breast cancer. It was aggressive. I was very lucky that I found it early as I did, but I did go through surgery, chemotherapy, radiation, and
all the fun stuff.
Oh yeah. And
poisoning, burning, and slashing.
Yeah. And then came out on the other side, and I was like, okay, I've got to really figure out, why did this happen to me, and what can I do to prevent this from happening again, or how can I help my patients?
Yeah.
And when I first went to AFMCP, it was after I started working at Canyon Ranch in Lenox, and where I met you, and
functional medicine training program.
Exactly. And it was just like this light bulb went off in my head, where I was like, okay, this makes so much sense. I want to think about this in a totally different way. We've got to look at how all the different systems in the body impact if you're going to develop cancer or not. We've got to pay attention to the terrain in the body, the soil, the things that are feeding the cancer cell. And so each person, it's different. For me, I had to really focus on supporting my microbiome and detoxification and stress. But for somebody else, it might be really working on reversing insulin resistance,
diet,
right? Or diet. And so it's really important to have a real personalized approach here. And it makes a huge difference.
Yeah, it does. And I think what I want people to understand is that we strongly support the use of traditional cancer treatments, whether it's chemo, radiation, or surgery, but it's not enough, because it's treating the cancer, not the patient and the soil in which the cancer grew. And so functional medicine is an approach that really treats the soil so the cancer can grow back or that you won't get it in the first place. And I think that's a really unique approach. It's not either or. Right. It's not like, oh, just have green juice and your cancer is going to go away.
Yep.
Forget that. You need to deal with it. But using supportive treatments, it works better. We have a colleague and a friend who recently had throat cancer, and it's 50-50 on that. But he did a ketogenic diet when he was going through treatment. Now, there's a lot of science on this, and one of the top cancer specialists, Siddhartha Mukherjee, who wrote The Emperor of All Maladies, is doing a lot of research on ketogenic diets and cancer. Yep. And he came up to me once and he says, "Mark, we made an amazing discovery about cancer." I'm like, "What is that?" I said, "Is it sugar?" He's like, "How did you know?" I'm like, "Yeah, well, it feeds the cancer." And he said, "We're finding that, using chemotherapy along with ketogenic diets or even the fasting mimicking diets, different approaches, intermittent fasting, can actually help the chemo radiation work better and have higher cure rates." And so
because it puts those cancer cells, they're stressed in those situations, so they can't survive as well. And so the chemotherapy kills those cancer cells in those when somebody's on a ketogenic diet or a fasting mimicking diet, those cancer cells are more at risk, and so they die off
because they only eat sugar. They can't live on fat.
Right.
So we have like we're hybrid.
Yes.
So we can run on gas or electric, right?
Yeah, right.
Well, same thing with your body. You can run on carbs or on fat.
Yep.
And when you run on just fat, it changes your metabolism, and the cancer cells only run on sugar.
Yep.
So they starve. So this is just one example of the kinds of things we do in functional medicine to help our patients do better through treatment and actually prevent it after, and to actually not get it in the first place. So people feel sort of helpless about this, but there's so much we know about what causes cancer, the things we can measure and test for, the things that you sort of discovered on your own. And I think it's sort of shocking for people to understand that traditional medicine just doesn't even talk about this. Right.
They're so focused on the cancer at the acute time, which is important. But we've also got to really work on, let's prevent it from coming back. Let's prevent it from happening in the first place.
And the dietary advice is terrible you get in cancer centers. I have a friend who was a top radiation oncologist at MD Anderson, which is like the top cancer center in the world. And he was like, "Our nutritionist, I'm just struggling because they say if you have breast cancer, don't eat tofu, but you can load up on ice cream."
Right. Which
and
is
I'm like,
so
what?
backwards.
Eat the tofu, forget the ice cream. They don't say stop drinking wine or don't eat ice cream or sugar, which is driving the cancer cells.
Right. Creating a terrain in the body, which is feeding cancer.
Yeah.
Right.
So
absolutely, we're looking for all those things that may create a terrain that will feed cancer, whether it's high insulin, high blood sugar, high insulin levels in the body, high inflammatory markers, so high inflammation in the body, which will drive cancer.
Yeah. Cancer's inflammatory. People don't realize that.
Absolutely. Right. So we look for that. We test for markers that measure inflammation, and then try to figure out why is there inflammation and what can we do to lower it. For some people, it might be, the insulin resistance that's driving the inflammation. For somebody else, it may be the gut and, imbalances in the microbiome that's driving the inflammation. So we really want to look deeper.
Or toxins.
Absolutely.
Right? So when you go to a traditional oncologist, they're just looking at the pathology. They're not looking at the biology. Right?
Yep.
And they don't actually look at the terrain, which is your nutritional status, your stress level, your
sleep,
level of toxins,
right?
your
your
sleep,
toxins,
your microbiome, your genetics around. I mean, they look at some genetics, but it's not the kinds of things we look at, which are more functional things, and not the BRCA gene, which is
right.
But it's interesting. The BRCA gene. Back in the 40s, they sort of had records around this, and then the risk of cancer was like 30% if you had the BRCA gene. Now it's like 70%.
Right.
Why is that? Same gene, because the environment's different.
Yep.
Our diet's different. Toxic load is more. Stress is more. All these other variables are affecting the gene expression.
Right.
So even if you have the genes, you're not necessarily predestined to get something.
Right. So we call the BRCA gene like a high impact gene, right? It increases risk substantially of breast cancer, but so many women don't have the BRCA gene and still go on to get breast cancer.
Yeah.
So we also look at these low impact genes that we can really influence with the environment, genes that aren't going to cause a huge increase in risk of cancer. But if you've got multiple different ones together, they can influence your risk. And what's most important with those low impact genes is we can really influence how they express themselves, with our environment. So we can influence, the expression of some of our genes by eating a diet that's really rich in our cruciferous vegetables and sulforaphane.
The broccoli family.
Yeah, the broccoli family. So, and we can maybe influence how these genes work by different supplements or different changes in diet. So like I had a woman who came to see me. She was 42. And she had an estrogen receptor positive breast cancer. And she went through surgery, and then they did tamoxifen. And she came to see me because she wanted to prevent this from coming back, right? So she's like, I really want to figure out why this happened and want to prevent it from coming back. And so we did multiple different evaluations on her. And one of the things that showed up was when we did some genetic testing, again, those low impact genes, we found a variation in the COMT gene. And the COMT is a gene that encodes for this enzyme, catechol methyltransferase, which is
mouthful, but
that.
It has to do with what?
Yeah, it has to do with methylation, right? But it's been found that methylation just means the transfer of these methyl groups, which come from a lot of our folate, our B vitamins, like folate, which is in all of our foliage, our green leafy veggies,
There's a carbon and 3 hydrogens that has to be shared between different chemicals in the body, and if it's not working, you get all kinds of problems, whether you get cancer, you get dementia, you get heart disease, you get depression. So these have to be working.
Yes. And so if this enzyme doesn't work as well because of your genetic predisposition, then your estrogen in your body doesn't get broken down and gotten rid of as well. It can become more cancer producing. It can change in a way that's less healthy for the body. And so we know that we can influence that gene when we give a diet that's rich in folate, all those green leafy veggies. We can sometimes influence that gene we often give like methylated B vitamins. I think this
special forms of B vitamins. You don't go to the grocery store, you get, folic acid or B12. It may not be the right form to actually activate these things or to bypass these enzymes that aren't working so well in the body.
Yeah, I mean, we have a concern about folic acid, which is the synthetic form of folate. So folate can be what we get in our food, right? Our foliage, our green leafy veggies, lots of other foods too. There's a synthetic form called folic acid, which actually has been associated with maybe an increased risk of cancer. There's some concern about this synthetic form. And that's found in a lot of not the highest quality, not the vitamins we use, right? So it's found in some B vitamins and multivitamins that we're not going to choose to use because for some people, they can't utilize it in their body. What you really want to look for is a methylated form of folate. So this type of folate that's activated, that's found in a lot of our food. Like when we're eating folate-rich foods, it's going to be high in this methylfolate.
Yeah.
But if you're taking your supplements, if you're taking a multi or a B complex, you want to look to make sure it's a methylated form of folate. Because the body, for certain people, that's more necessary than others, but the body it has an easier time utilizing it. And that helps with this whole estrogen metabolism process.
And just to back up on that, so people think there's something called estrogen. There isn't. There are estrogens.
Yes, that's true.
And they're all a little different. And some are more prevalent in, early life, some in reproductive years, some in menopause. And they all have to be metabolized by the body.
Yeah.
And it's sort of like going down a pinball machine. You don't know where it's going to go. And some people don't have good detoxifying mechanisms for all this estrogen. And then they get sort of estrogen toxicity.
Right.
And I think, one of the things that's really striking about what you're saying, particularly in terms of breast cancer, is that, this woman had estrogen receptor positive breast cancer. And what that means is that this is an estrogen sensitive breast cancer. It feeds on estrogen.
Right.
Right. And so the beautiful thing about functional medicine is that we can, test for all these metabolites and figure out how to change the pinball thing so it's going down the right pathway to be anti-cancer versus pro-cancer. And we use lifestyle, diet, supplements, all kinds of things to do that. But what's really important to understand is that a lot of us are out of balance and we have imbalances in our hormones and we make too much estrogen.
Right.
And maybe not enough progesterone. And that leads to symptoms of estrogen overload.
Yes.
And I remember, medical school was a very nice way to talk about patients, but we remembered how to remember the profile of someone with uterine cancer. Yes. Fat, 40, and fertile, right?
Yep. Right. Which is essentially saying high estrogen.
And if you're overweight, you make higher estrogen.
Right.
Obesity is linked to cancer. It's linked to breast cancer. Insulin resistance and prediabetes is linked to breast cancer and many other cancers.
We have this enzyme aromatase in our fat cells, and aromatase takes other hormones and turns it into estrogen.
Yeah.
And this happens in men and women, right? So when you have more fat cells, you have more aromatase, and so you have more estrogen. And so that then is why, or maybe one of the reasons why that obesity, having more fat cells, is linked to estrogen-related cancers, which would be breast, uterine, prostate, is definitely related to this higher estrogen level in the body, for example. So one of the things everybody can do is make sure their body fat percentage is lower.
Yeah.
Right? Because that helps with lowering estrogen levels.
And we actually have a whole strategy for one assessing this in functional medicine, which is not what your traditional doctor will do if you go to breast cancer treatment. And we have a whole strategy for how to balance out your hormones, right?
Yes.
So things like diet, exercise, stress reduction, working on your microbiome, the right nutrients, getting rid of toxins that screw up your hormones, all these things, fixing your liver.
Right.
These can all really help. Fiber.
Yeah, we really want to pay attention to those xenoestrogens, right? Those are those toxins from the environment that act like estrogen in the body.
Yeah.
So those are environmental toxins, things we know about like BPA, plastics, parabens, pesticides.
So you put your sunblock on, you get all these parabens, maybe you're causing cancer.
Right. And because they can bind to, they're xenoestrogens. They're chemicals from the environment, but they can bind to the estrogen receptor in the body.
Yeah. So they're like hormone mimickers.
Yeah.
And they're effective and powerful at extremely low doses. So I'm not that exposed to pesticides, or I'm not getting that much parabens or whatever. They work in a microscopic dose to have a macroscopic effect.
Yep.
And they're synergistic. So people say, oh, this one chemical, maybe it's not so bad in animal studies. But we're exposed to hundreds and maybe thousands of these chemicals all at the same time. And our different abilities to detoxify them affect our risk. And particularly in cancer, we know that these chemicals are associated with cancer. So how when someone comes in with, let's say, breast cancer, what are the kinds of tests we'll do? What are the recommendations you'd make? I mean, you have a whole incredible DVD I encourage everybody to get. Tell us about the DVD.
So it's called Breast Wellness, and it's tools to prevent and heal from breast cancer. And it looks at the functional medicine approach to breast health.
And where can they get that?
They can get it at my website, drboham.com. They can also download a free ebook there. I think it's also on Amazon and Vimeo. It's everywhere, right?
There you go.
Actually, it's on our UltraWellnessCenter.com too. Yeah.
So what we do?
But so you're looking at that comprehensive approach and treating that individual patient, right? And, we're focusing on, is there toxins that we need to lower? You were mentioning that aspect of toxic load, which I think is really important, because we know that sometimes it's not just one toxin, but it's a little bit of a lot of different toxins. So we can look at things, we can measure things like, is there high oxidative stress? Right?
That's like free radicals, right?
Yeah, right. Which would indicate an imbalance between the antioxidant levels in the body and the free radical production, right? So sometimes when somebody has oxidative stress, that just means that they've either produced too much free radicals because of toxins or infections, or they don't have enough antioxidants, right? Because they're not eating enough of the phytonutrients that are the plant foods that are rich in antioxidants. And when we see that oxidative stress, which we can measure, we really work to lower it with a phytonutrient-rich diet. Sometimes we then have to look to see, well, why is it high in the first place? Yeah. Right? That's asking that question. Is there some infection? Is there some toxin? Because you've got to figure out why so that you can help with
insulin resistance, prediabetes.
Yep. Weight, that belly fat.
Gut issues. You talk about how you measure the poop of patients with breast cancer. Why is that relevant?
Right, because I know, right? You're like, how is the poop connected to? Well,
there's a microbiome in the breast.
Yes, right, and they're finding that the microbiome in the breast is different in women who have breast cancer. So there's so much more we're going to learn here. But in the gut, we know that if there's an imbalance in the microbiome, there can be an imbalance in this enzyme called beta-glucuronidase. It can increase, which can then lead the body to absorb back more of the estrogen and then put you in this situation where you're more estrogen dominant or overloaded.
So basically there's like overgrowth of these bugs that shouldn't be there that produce this enzyme that then when the estrogen is detoxified by the liver and dumped in there in the bile, which is how your body gets rid of excess estrogen, it sort of unpacks it a little bit. And then you end up reabsorbing it. And so you get this increased reabsorption of estrogen, high levels of estrogen in breast cancer.
So we're looking at that level. We can measure that, and we can measure just the imbalances in the microbiome, which are impacting that level as well as multiple other things in the body.
Yeah, so, I mean, given the view of functional medicine, which looks at root causes and systems, the fact that antibiotics cause breast cancer is not a surprise.
No.
Right?
And as a kid, I was on multiple rounds of antibiotics for urinary tract infections again and again and again. And then that just was probably the thing that, along with some of my genetic predispositions and some toxins, really allowed my body to not work in an optimal way.
Yeah, it's so powerful. So we actually, through things like lowering sugar and starch in the diet, through things like adding certain fibers to help with gut flora, things like certain anti-cancer foods like flax seeds. We can actually, and broccoli, family vegetables you were talking about, we can really have an impact on exercise and stress reduction. We put together a whole plan for people. It doesn't leave them feeling so hopeless and helpless and like, I just have to wait around to my next scan or my next mammogram and cross my fingers and stress out for the next 6 months or a year.
Right.
You can actually be empowered to understand what your biology is doing, what the imbalances are, how to fix them. And is there a guarantee you're never going to get cancer? No. But you're stacking the deck in your favor. And you're understanding the imbalances that are driving cancer, and you're changing the soil.
Changing the soil.
And that actually won't allow the cancer to grow. Right. So that's a really powerful model that should be part of traditional oncology. And there are some centers of oncology that are integrating this. But it's unusual. So let's take the next, a little bit and talk about the next case of a patient who hasn't had cancer, but was terrified because there was tons of cancer in their family.
Right. So this was a 48-year-old gentleman, and he had not had cancer yet, but he had a sister with breast cancer. There was stomach cancer in his family. There was colon cancer in his family, and prostate cancer. And so, he wanted to do whatever he could. He wanted to create that terrain where cancer was less likely to grow. And we also did genetic testing with him. Again, not the big genes, but some of those low impact genes. And we found a variation in one of his genes called the GSTM1, or glutathione transferase gene.
Yeah, I got that problem.
And me too. I'm in that club too.
Well, it's interesting, the people who have this specific gene actually are much more likely to be in hospitals and sick and have issues, right? And just to back up, before you get too much more into it, I just want to sort of help people understand, what genes are. So you have like 20,000 genes, and it's basically this genetic code that is a 3-letter code of is a gene. So you have, let's say, 4 letters. Computers are 1 to 0. Your biology is 4, like it's 4 ACTG. So if there's a variation in that code, it may not be a mutation. It's just a slight variation. It's sort of like different. In America, we spell color COLOR. In the UK, they spell CLOUR. So similar, but it has different effects. And that is something we can do something about, right? If you have the gene for Down syndrome, you can't do much about that, right? If you have a gene like for the glutathione, you can influence its function, hence functional medicine, and change the way those genes are expressed through things like diet and exercise and lifestyle and supplements and detoxification, all kinds of strategies that we use. And so we check genes that typically aren't checked. And we see, where does this person have the potholes, and how do we help them avoid them?
So this, glutathione is this master antioxidant and detoxifier in the body. And we know, like you mentioned, when people have a defect in this gene, in the GSTM1, they don't tolerate toxins as well from the environment because their body is not as able to take their, to make as much glutathione and then use the glutathione to get rid of the toxins.
Yeah, sort of glutathione is like sulfur, smelly, sticky. It's like fly paper. And all the nasty toxins stick to it, and then your body gets rid of it. But if you have low levels, you're screwed.
Right.
Like
and,
me. That's why I got mercury poisoning.
And one of the reasons you can have low levels is because you have some variations in these genes. And so for people like that, we really want to support. I mean, we want to support detoxification with everybody.
Right.
But with those people, we really focus on supporting how well they can produce glutathione. And so we will really focus on things like sulforaphane. Sulforaphane comes from your cruciferous vegetables, and it
Broccoli,
helps
collards, kale, Brussels sprouts, cabbage. This is like basic stuff in food that actually has powerful anti-cancer compounds. And sulforaphane is one of those. They've studied at Johns Hopkins. They have supplements you can take.
Yep.
We have that on our online store. It's really effective.
Yeah, that's actually one supplement I take every day. I mean, there's a bunch I take every day, but that's one I always take because it helps the body with production of that glutathione. And that really, as we said, helps with pulling those toxins out of the body.
And there's other stuff that you can take, like aside from things like garlic and onions and the cruciferous vegetables, there's a lot of supplements we use in functional medicine that, they're not replacements for a healthy diet, but they help to produce different molecules in the body and help different functions.
Yeah.
So N-acetylcysteine is one of the building blocks of glutathione and helps increase it. In fact, when I was in the ER as a doctor, because I worked in the ER for years, I learned that if someone came in with a liver failure from Tylenol overdose, we gave him this, quote, drug, which was called Nucremist or N-acetylcysteine, which smelled terrible, tasted terrible. We made him drink it.
Yep.
I guess a suicide attempt wasn't enough. and so when I started doing functional medicine, I'm like, wait a minute, this is incredible. This is just a supplement that you can get in the health food store.
Yep.
And they even are studying it for kidney failure that's caused by dye when you get an X-ray.
Right.
And they actually can prevent kidney failure by giving them this, cheap supplement.
NAC, right.
Yeah.
Yeah.
So it's really important.
I think that's really important about supplements. I think that what's really, they can be so beneficial when they're targeted and used for that individual person and what their needs are. And I think that's really sort of a take home here with supplements is that we can't, well, some people take the kitchen sink. They take a lot of different things and just hoping that one of them is going to be the right one for them. But one of the things we can do, especially with some of this genetic testing we're talking about and some of this evaluation that we're looking at from a functional medicine approach is we can really focus on, okay, for this individual person, what are the ones they really need to focus on? What's the food they really need to focus on? What are maybe some supplements that they need to focus on to help them get to their optimal health? And that's, I think, when we see them work even better.
Yeah, right? And there's amazing stuff that also is being looked at in terms of detoxification and cancer treatments like high-dose vitamin C IV, which we do at the UltraWellness Center.
Yep.
Can be extremely effective as an adjunct treatment to traditional cancer therapy to reduce the risk of the cancer not responding to the chemo or afterwards to prevent it from coming back. So there's so much that can be done. And I think, one last point I want to make is that, we think of the tests we do in medicine as prevention. So a mammogram is prevention. Colonoscopy is prevention. The prostate exam is prevention. They're not prevention. They're early detection. So you have to actually already have the problem before you find it positive,
right?
Which is good. It's a screening test and you find it early enough, you won't die. That's great. But it's not true prevention. And what we're talking about in functional medicine is true prevention.
Yeah.
Whether you've already had it and you want to prevent it from coming again, or you have a family history you're worried about, you actually can map out what's wrong and fix those things. And it makes a big difference.
Absolutely.
Yeah. So just to recap here, we are so inundated with cancer. There isn't anybody that hasn't been touched with it. My family, I had my sister and my dad both have cancer. And they were sort of late stage when they discovered them, which is hard to do anything about. But I don't want people to feel disempowered because with functional medicine and using that lens and the kinds of work we do at the UltraWellness Center, we can map out what the imbalances are, what the risks are. We can design a personalized treatment program for you that actually tests the things that matter, whether it's your nutritional stuff, we're looking at beta-glucuronidase in your poop, or looking at heavy metal levels or pesticide levels, or looking at insulin, or looking at the methylated nutrients that you need, or your glutathione levels. We check all of that. And that helps us to create a personalized roadmap for you along with other things we recommend, dietary recommendations, because we know so much about diet and cancer.
Yes.
And that is such a big, at Cornell where you went, and I remember I took a nutrition course and I had a book, it was like from the National Cancer Institute called Diet and Cancer. And this was back in the 70s. And we know a lot about this. I remember speaking to my oncology, attending when I was doing my oncology rotation in medical school. And I said, what percentage of cancers do you think are diet related? And I thought he was going to like 10%, 20%. He's like 70%.
Yeah.
I was like, whoa, because that's good because it means we can do something about it.
We can do stuff about it.
If you love that last video, you should check out the next one for sure on getting to the root cause of all disease. Hydration is really, really important because most of us walk around dehydrated. Most of us don't drink enough water. We have other fluids like sodas and juices and coffees and teas.